Do you know that of all of the healthcare dollars, if you had a $1 in healthcare, 10 cents goes to mental health? Doesn't make any sense when 1 in 2 people will experience a significant mental health issue in their life.
I'd like to welcome you to our very first podcast for It's Okay Foundation.
And what we do here is open up the lines of communication and conversations about men's mental health supports.
And today I'm very pleased to be welcomed by Dr. Susan Farrell, the CEO of the Ottawa branch of the Canadian Mental Health Association. Thank you for coming.
Thank you for the invitation.
So what we're trying to do here is to probably a lot of what you do in your job is to spark conversations, get people talking about mental health, breaking down barriers and stigmas. And as you can tell, middle-aged man, and that's probably one of the toughest areas that people have trouble breaking down these barriers to talk about as much as it probably should be done. What I wanted to start with is, how did you become the CEO of the Ottawa branch of the Canadian Mental Health Association, and what led you to where you are today?
I'm a clinical psychologist, and when I moved to Ottawa to complete my graduate training, I really wanted to work in community mental health. I really wanted to understand how mental health conversations could happen in the community. So my advisor said to me, if you want to learn that, you need to go to CMHA. So I was the first research student at CMHA Ottawa almost 3 decades ago. It's been a while. And then I became a clinical psychologist. I've always worked on community teams. I've worked in hospital settings, and I worked at the Royal for over 2 decades. I had a wonderful time working at the Royal. And then the CEO of the Canadian Mental Health Association was getting ready to retire. And I knew it was the time to come and take my research, my clinical and my advocacy training, and have a new opportunity. So 18 months ago, I joined CMHA Ottawa. I've had a wonderful opportunity. I'm really proud to be there.
Wow, so you came back home.
I went back home, yeah.
So in your experience at the Royal, and obviously where you are today, what has changed in the mental health field? And this is probably a big answer. In 30 years, what's the biggest changes that you've seen?
Conversation and language. So the language has changed. We used to talk about the depressive, the schizophrenic, those sorts of things. And now we talk about person-first language. People with depression, people who live with depression, people who live with schizophrenia. People first, their diagnosis second. Even more important than that, we talk about our experiences much more freely. There's still too much stigma in the world, but it's a much easier conversation to say it's okay not to be okay.
Yeah, and that's obviously a big part of what we're trying to do here is like as we've come to learn a lot in the last few years, that most people are struggling with something. And I think the biggest thing that I've noticed through my experience going through this field is that there's different levels where everybody is, obviously. And I was talking to somebody recently and saying, like, mental health, it's not like a broken leg, it's not like a broken arm or twisted ankle, and it's like, okay, there's the fracture, let's fix it, there's this, let's do this. So there's a lot of different places where people can obviously enter your world, where they are with their mental health. There's obviously just going to see their family doctor and talking to a professional, or there's literally probably walking into an emergency room or calling 988 or 911. What do you feel is the part of the industry that needs to have the most attention put towards it right now?
With conversation has meant that the need for service has increased significantly. So most of the parts of the system need more resources. That French door that you talk about could be a family doctor, could be an employee assistance program, could be emergency. There's resources needed there. We do a lot of linking with some of those resources so that people know how to contact us. But the whole system needs much more resource. Do you know that of all of the healthcare dollars, if you had a $1 in healthcare, 10 cents goes to mental health? Doesn't make any sense when 1 in 2 people will experience a significant mental health issue in their life. It isn't even 1 in 5 anymore. It's closer to 1 in 2. So the system needs more resources, and people need to know more about them. We need more resources so people can have free access. All the services we offer at CMHA are free of charge, and so many people can't afford private services. We need to keep growing the public offering of services.
And do you feel like there's the support from the government's level? It's just not being allocated properly, or is it like, does there need to be more coming from?
I think increasingly we understand mental health has provincial support, but it doesn't have provincial financial support to a sufficient extent. And the range of mental health services aren't adequately funded. So certain things are getting funding. The provincial government even has a center of excellence to look at mental health pathways. But the reality is it is still so under-resourced that supply and demand are just not matching one another. And that creates wait lists. The last thing you want to do when you really need some help is wait.
Yeah, and I think a lot of people don't know where to go.
That's true.
And like, I've had some dealings with your organization in the past on a personal level, and being able to be put in the right direction is obviously essential, because you don't want to be stuck in the system somewhere and going in the wrong direction.
Right.
But when people enter the system, whether it be, like I said, in an emergency room situation, or just going to see a family doctor because they're feeling a little off or need a tune-up or whatever, what would you say is, like, if somebody is a friend or a family member of these people, and like, I get asked all the time, like, what are the signs that people should be looking for? Because sometimes things escalate very quickly to a point where you have no idea how it got there so fast. What are some of the things that you feel that people should be watching in friends and family members that might be, okay, this person needs to?
Good question. In a single word, I would say change. So friends and family, we know each other. So are you seeing change in the person? Could be change in what seems like their mood. Are they more irritable? Are they a bit more sad? Are they change in their ability to socialize with others? They suddenly don't want to go out and spend time with people. They may not even want to spend a lot of time at the dinner table, talking to the people that they most care about. Change in their sleep. People can sometimes want to sleep a whole lot more, or are starting to sleep a lot less. Change in their eating. So people sometimes eat more, significantly, or quite a lot less. Change in their enjoyment of activities. So things that really used to bring them joy just aren't anymore. And change in how they want to talk about the future. No one change is going to say, oh, it's the symptoms of this. It's not something easy to look up on WebMD, but the people who know us best know what change looks like, and any change is a good way to start that conversation with a healthcare provider.
Yeah, I think I can relate to the part about the stop doing the things that you enjoy. I know a few years ago I was playing hockey regularly, and then I just got into a situation where I just didn't want to go anymore, and I made excuses as not to go. And looking back on it now, I didn't realize I was even going down that path, but that was probably an indicator that I was going down that path. I started to walk away from things that I really did enjoy doing.
Yeah.
So if somebody did have a friend or family member that, obviously having a conversation with them is the first step, but if they feel like maybe there's pushback from that person, is there anything people can do that without their, don't want to say consent, because it feels like you're literally dragging them into a situation they don't want to go down, and they're obviously going to push back even more if you do that. But is there anything that you feel that you could, so people can do for these individuals that might help?
Good question. You're right. Mandated treatment, the research doesn't suggest that makes a lot of difference. So we suggest at a much earlier stage that friends and family and concerned others just start having what we call a safe conversation. You know, it's not, hey, Steve, you seem really different. You're not going to hockey. Like, what's up?
Like
what's
an
the
intervention.
problem? Right. It's more, here's what I'm noticing. And here, so noticing is a really powerful word because there's no judgment in the word noticing. I'm noticing that. Is everything okay? I'm noticing this. Is everything okay? That's a slower conversation. That is not a quick intervention and quickly getting services, but it helps a person realize things. If you were telling yourself stories to not go to hockey, if you were justifying that, it takes the people who care about you to say, hey, I'm noticing some changes in your patterns. You want to talk about it. We also have to tell other people when we're noticing it that we have some concern, again, in a non-judgmental way. But if we're seeing the slow slide of stress, for example. So in my life, the people who care a lot about me will say, I haven't seen you out for a little while, right? Because I'll go for really long walks in the evening. Or, we're inviting you out and you're telling us you've got a lot of office work to do. It's true, but I can sometimes put it aside, right? Or we're noticing that when you come out with us, you're always watching your watch and you're quick to leave, right? Those are good reminders to me that people are just noticing change.
Yeah.
When it gets more significant and we're really genuinely worried that something is what we call acute or more urgent, we have some other choices. If it's very urgent, we need to bring someone to emerge. And if they won't go and it's really urgent, then we need to call emergency services. That's not a lot of cases, but we need to know that those options exist. When we start to get a bit worried about someone, we can call their healthcare provider. The physician can't talk to me about my family members, but I can tell them my concerns about my family member, and they might encourage an appointment. We can go with people to appointments. It's hard to go, but if I take my loved one and he or she says this much, I can say, here's a few more things I'm noticing, right? Fill in the blanks.
Yeah. You're skipping over
Right.
these very important
That's
things.
right.
So.
That's right. I live with a whole household of wonderful people and everything's always fine.
Yes.
Until it isn't. And so we've learned to take that language and spread it out and talk about change.
Yeah, and I like the whole okay, like asking how are you doing? It's okay. Or how are you doing? Like, I'm fine. Like,
Yeah.
But you're like, how do you dig a little bit deeper without crossing the lines and the boundaries and getting into an argument over something when you're just trying to be supportive and helpful and
It's a good
coming
question.
from a good place that could lead to almost a worse off situation because then resentment comes into play and stuff like that.
That's right. And it's easy to seem judgmental, right? So that's where I have found the word noticing to be pretty powerful. I'm noticing that. Because then if you say, you know what, Susan, you're totally wrong. Okay, then I back off for a little bit and I try something else a little bit later.
It's not confrontational.
Right. It's not, hey, Steve, I've diagnosed you with, or hey, Steve, I've noticed that.
Yeah.
It's different language, right? It's a different way of talking about it.
Yeah. And like when we get back to the conversation I was just having about the options of, family doctor or your services or ultimately possibly a 911 or an emergency room situation. Sometimes I think people might have a problem or trying to figure out where they are at that point. Like I know on a personal level, I was helping a family member over the holidays and we literally were standing in the kitchen and it's like, should we go to the hospital?
Right.
Like, or should we call 9? Like, what do we do here?
Right.
Like, well, and so, I know there's support systems out there like that, but for somebody that hasn't gone through that process yet, say they were to take a family, it felt like it was a severe enough situation that they felt like they needed to go to an emergency room.
Okay.
Talk to me, if you can, through what that process would be and what people would expect that to happen when they walk through the door with a loved one saying, this person is in crisis, what do I do?
Good question. So I have tremendous respect for the folks who work in emergency because they see everything, right? And it's always urgent. But in mental health situations, sometimes the general public has a misperception about what could happen when you go to emerge. Family members often think the minute I bring someone to emergency, they'll get admitted to hospital and they'll get lots of care. And sometimes they do get admitted, but the staff have to decide is how urgent is something. And unfortunately, emergency rooms are usually the things that are open longest. So people go in and they are assessed, and they're assessed for the severity of the situation, the urgency of the situation, and whether or not being in hospital is the right solution, or if you're better to link to another service. We have a service at CMHA called system navigation. So when people go, if they can go home, but they really need some quick attention, they get something called an e-trigger, which means that my file at the hospital, my name with consent, goes to CMHA, and a CMHA system navigator is going to call me and say, hey, Susan, let's talk about the options in the system. Let's talk about supporting you, because that's the level of care I need, not sleeping in a bed in the hospital.
Okay.
So it comes down to issues of safety sometimes. That's one of the determinations of who's admitted, but also what else is in the community.
And if they do get the doctors and professionals feel like they should be kept
Admitted,
with them,
yep.
admitted, is it usually at the hospital? Is it at, like, sent over to, like, in Ottawa, like the Royal Ottawa? Would they stay at, say they were to walk in the Queensway Carleton Hospital, would they have room there to stay overnight? Like, or is it more of a, you're in a bit of a waiting room for a few hours and we keep an eye on you? Like, if you get admitted,
Yeah.
how long could that possibly be for?
It's an excellent question, and probably even right this minute, the admitting clerks couldn't tell you for tonight. So it's always that very delicate balance of who else is in a bed. So being admitted
And sorry,
means...
not to cut you off, but when you say in a bed, is there beds that are committed for mental health
good
support,
question.
or is it just a bed for a triage situation with an emergency room?
It really depends. So the first one is you're usually admitted and you're in the emergency space.
Okay.
And then there's a determination, can you move to a mental health bed? How full are they? I know when I was working in the hospital system, they're usually even over 100%, which means that notion of hallway medicine and other sorts of things, right? So sitting here, we couldn't predict the pathway in Ottawa for a person because it just depends on everything else that happens. But they make determinations about where should that person be. And we've come to the conclusion that we often have much more need than we have supply. So there's often determinations, and people may be in emergency or other spaces for a bit longer than they would have wanted.
And when you say, we all understand and can see very clearly that the need is going up and up and up. It's obviously growing. Do you think it's a bit to do with the fact that people are more open to admitting that they have some struggles with mental health, or there truly is more people that have issues with mental health? Because I'm thinking back to when I was younger, and we didn't talk about it as much, but I can think back, and yeah, I did have mental health. I could have used some supports when I was younger, but I just didn't tell anyone. But do you think it's a lot of it has to do with the people are starting to become more open to admitting that they need it? Or do you feel that there is actually more and more people that today than there were maybe 30 years ago that...
It's a good question. I think the answer is honestly both. So I think the conversations and hopefully the reduction in stigma mean we are talking about it more, and we're more likely to seek services, which is going to increase the demand for services. I do think that there are a lot of life events and world events that have contributed to increased mental health challenges for people. There's pretty good research on the effects of things like COVID and what that did for a lot of people's mental health. We have a toxic drug supply in our city. So for people who have a concurrent disorder like a mental health issue and substance use issue, there's a lot of concern about what does the drug supply look like and what does that do to their mental health. There are geopolitics, which I'm really not going to touch in your podcast.
Fair. Yeah, we could talk for hours.
Right, but for a lot of people, all of those conversations and all of the what ifs contribute to a sense of at least an unsettling of our mental health, where it really is a good idea to get some support.
Yeah, almost like somebody mentioned a term to me the other day I'd never heard, called doom scrolling.
I heard that the other day too, actually.
I'd never heard about that before, and like literally 4 or 5 days ago I heard it for the first time. But it makes sense. Like, you just look at your phone and it's like, oh, the world's falling apart. It's like, oh, okay.
I had almost the same reaction. The other night I thought, oh, that's why they call it this. Because my mood changed significantly with 15 minutes of reading the news.
Yeah.
Yep.
No, I can totally understand that.
Yeah.
what we've sort of been working on with It's Okay and getting the conversations going with mostly focused on men, like like myself, obviously. But I think it's become, and you mentioned COVID, and when you mentioned COVID, it had me spark something in my mind about the youth and how the effect of stuff like COVID and like I have a 21-year-old, and I know that the COVID effect of not going to school and being around people physically for a number of years had a toll. What is your thoughts and what you're seeing right now with the younger generation? And we'll sort of stick into that late teens, early 20s, and what you're seeing out there right now.
So CMAJ serves a number of youth. It's predominantly youth who are street involved with more serious mental health issues. But that is my first answer to your question, is that we see folks who have more significant challenges, even in terms of their mental health, their ability to access safe housing, the drug supply, finish school, etc. So that's sort of one part of the youth population. In the broader part of the youth population, we hear a lot from schools and other agencies about folks who have really felt that their ability to socialize, their, as you say, time with others, those sorts of things are affected. And there are a lot of people who talk about anticipatory anxiety. What's it going to look like as I become an older adult if this is what the world looks like now? Mm-hmm. So I wouldn't be able to speak to the whole cadre of youth. That's just a small part of our services, but we certainly hear threads of these conversations and working with all of our youth-based community partners.
And if somebody does have, we'll say somebody under the age of 18, mm-hmm. and they're concerned about them, and we talked about taking them to an emergency room. Like, should they take them to CHEO, or should they just take them to any emergency room? Or if they're in a certain age group, should it be it's CHEO as priority one, or would they get the same services if they were to walk into, say, again, the Queensway Carleton Hospital?
It's a good question. Certainly I respect both tremendously. It probably depends a little bit on where physically is the person, what's the urgency, those sorts of things. I think that even that first admitting clerk at the hospital is going to help direct things a little bit. CHEO is certainly the regional center for young people. But if someone was really close to the Queensway Carleton and you had an immediate safety issue, I think every hospital would say you deal with what's immediately in front of you.
Okay. But if you were to walk into an emergency room, you were basically in the system, in the process, no matter what age you would be in.
Yeah, I think they would help navigate you. If they believed that you were better served by CHEO, they would build those bridges to help you get served by CHEO.
And as I said before, I've done some fundraising and some events for supporting your organization.
Thank you.
No, it was, it's funny how things play out, because I was, the very first thing I did, which was a walk across Ottawa with my golf bag and raise a few dollars for things. I came across your organization. I was like, this is something that I would like to, put some money towards. But obviously it's a small drop in the bucket of what you're ultimately, probably the need is there for. What is it that, other than just sparking conversations, what is it that other people are doing out there to help support an organization like yours without, the government level and stuff, just the general public? Like, what do you see that people try to do to help? Or what can they do to help?
Yeah, we're really heartened and appreciative when people like yourself and when others do things to raise awareness, raise conversation, and frankly, raise funds. All three matter.
Yeah.
So we've talked a bit about awareness and conversation. Funds really matter for us because there are parts of the services we deliver for which we get no funding. We have a big part of our services called peer services. That means people with lived experience. So people who have had mental health challenges, they may have been clients in the past, or they may be peers with lived experience. They come and support a lot of our programming. We have some on as paid staff. We have some peers as volunteers. We do programming where peers and some of our clinicians pair together and deliver what we call courses in Recovery College. So all of the peer initiatives really matter because it keeps conversation going, keeps a point of connection because someone's had a similar or shared experience. But peer services are not funded services for us. And so we have really made a conscious effort But any funds we are able to raise through private donations, through corporate donations, through individuals doing brave things, we direct those to peer services.
So you obviously you're focused on Ottawa. So Canadian Mental Health Association, you have the Ottawa branch. Is there one branch in most major cities in Ontario, and then it goes like obviously across Canada, and then is there a head office of Canadian Mental Health Association?
Yeah, that's a good question. So we're something called a federated model, which means that in Ontario there were 27 CMHAs, and we're all a little bit different in our size and what we offer. But we are all standalone with our own boards and our sort of own staff teams, but we are connected in an Ontario division.
Okay.
And then Ontario division is connected in what we call CMHA National. So we're a little bit like those nesting dolls,
Yeah,
if you will.
okay.
We're here, and then we've got Ontario, and then we've got National.
And the reason I asked was if somebody was to put in a donation or raise funds, would it stay within the community or does it go?
Oh, very good question. They're raising money for CMHA Ottawa. It stays in CMHA Ottawa.
Okay.
We are not required to share our fundraising. If CMHA National does
Yeah.
something fundraising, like the amazing push-up challenge they did,
Which we were about to see.
maybe by you. Some of those dollars stay with National, and then many come to Ottawa if the person targeted the Ottawa branch. So we are the CMHA Ottawa branch, as you well said
Yeah.
at the beginning, and so it's just being able to focus it that way. When we receive money, we keep it all very focused in the services we deliver at the Ottawa branch and the services we deliver to the broader community, like education.
Okay. Well, I think that touched upon everything that I wanted to discuss with you. Did you have any questions for me?
No, I don't think so, other than given how important it is to us to keep conversations going, and given the terrific work you're doing, what could CMHA Ottawa do to continue to support you?
Whew, that's an interesting question. I think right now the biggest, as we're starting to build this out a little bit, and this is, like I said, this is our first podcast, and we've done events that we're trying to raise funds for. I think the support that I've gotten from your organization, and I'm looking in the corner at Patrick back there,
It's wonderful.
has been great. Because when I first started down this road, I knew I wanted to, first and foremost, it was just spark conversations. But then a lot of people, they want, Ottawa is a very giving community, as you probably have experienced. Is it is a very supportive community, and a lot of people find that the best way to support is to write a check or throw money at something, which is great because
We appreciate it.
Yeah, 100%. But I think a lot of people, that is their go-to. So having a place to put that attention has been good, because when I first started doing these things, it was just like, I just want to spark conversation, and then people were like, but what do you want to put the money towards? It's like, well, I want to put it towards an organization that helps spark conversation. So it kind of went down that road.
Yeah.
So the fact that it's like we're Ottawa based, and so are you,
Yeah.
is a big part of why I like working with your organization. But I think it just, the biggest thing that people ask me is just, where will they end up if they enter the system and look for help? Because like we said at the beginning, and I used this analogy earlier today, and I use it all the time, is I've had back issues, and a chiropractor works for me. Other people, doesn't work for them. Physiotherapy works for them, or acupuncture works for them, or yoga. So it's different for everybody.
That's right.
And when you go into the mental health field, what might work for somebody might not work for somebody else. So having an organization that offers a wide range of options for people, I think is, because people hopefully will find what works for them.
I hope so, and I appreciate that, and that's exactly it. We're trying to offer a wide range, starting with a conversation, right? Starting with having the chance to be in the public and talk about how to notice in your friends and family, and how to notice in yourself, how to interpret that, and then get the support you need.
Yeah, it's the looking at yourself, and again, being in this sphere and these conversations, it's like, even myself, I have to stop every now and again and be like, am I okay?
Yeah,
Am I
that's
fine?
right. Yeah.
Steve, I've been noticing something.
Yeah,
So
yeah.
I like that phrase that you said, because it is something that is, again, it's not confrontational.
That's right.
And it could lead to a conversation, or it could be an easy answer that doesn't
That's
go
right.
anywhere, but it doesn't, the word noticeable is something that comes from a place of care.
Yes,
Not
exactly.
not a hard word like
That's right.
something that might put somebody on edge.
That's right.
So, well, thank you for being our first guest.
Oh,
It was
thank
an
you for
honor
the
having you,
opportunity.
and hopefully we can do this again.
Thank you very much for the opportunity.
Thank you
Good
so
luck
much.
with it.
Thank you. It is actually a sign of strength to admit that you are struggling with your mental health. So I think if you're at that point that you're able to actually reach out and seek help, whether it be through a family member, a friend, or a professional, it's the opposite of weakness.